Unlike acute pain, chronic pain refers to pain that does not respond well to long-term treatment or that recurs even after treatment. Chronic pain can occur in the body, brain or spinal cord. It is often difficult to treat. Epidemiological studies have shown that 8 to 11.2% of people in various countries have chronic widespread pain. You can often see people suffering from chronic pain around you. Pain is uncomfortable, but it is also a must-have. Because pain is a matter of survival. Chronic pain is classified as pain that lasts more than 3 to 6 months. In medicine, the distinction between acute and chronic pain is sometimes determined by the time since onset. Two commonly used indicators are 3 and 6 months after onset. Pain lasting for a period of 12 months, but some theorists and researchers see 12 months as the transition from acute pain to chronic pain. Some people use the term acute for chronic pain. A common alternative definition for chronic pain is pain that does not involve a set period of time and exceeds the expected healing period. Chronic pain significantly reduces quality of life. Acute pain goes away when the wound heals. Among those who suffer from chronic pain even though the tissues are completely healed. The most serious is complex regional pain syndrome. Even if it is cured, even if it is rubbed, the severe pain will be repeated. I've done several tests, but there's nothing wrong, but there's pain. When the pain became chronic, it is possible that there were changes in the spinal cord or brain. In the case of chronic pain, there are many cases where there are several problems at the same time even if the pain is in one place. For example, let's consider a case where the trapezius muscle is stiff. In this case, the trapezius muscle is also a problem, but there is a problem with the body shape that hardens the trapezius muscle. Therefore, even when treating the trapezius muscles that are stiff, you have to look at the body shape and look at the problem of nerve flow at the same time. In particular, the problem of nerve flow must be treated because it is one of the most important parts of the treatment of chronic pain. Chronic pain is when there is no major abnormality in the body, but the pain continues to recur. I go to the hospital because of chronic pain, but I am only told that there is nothing wrong. These three problems are lurking behind these seemingly unexplained symptoms. Chronic fatigue, chronic inflammation, chronic pain. These three issues are very related. Chronic inflammation is quickly diagnosed through testing. And chronic inflammation is usually accompanied by chronic fatigue and chronic pain. To lead a healthy life, focus on function, not disease. Signs of chronic fatigue include fatigue, tiredness, and exhaustion. Decreased memory or concentration. I have a sore throat and pain in the enlarged lymph nodes in the neck. I have unexplained muscle pain, joint pain, and headache, and the fatigue doesn't go away even after sleeping. It does not recover even after 24 hours after exercise or work. Various symptoms of chronic pain include it cannot be found even by diagnosis without special reasons or trauma. The back or side of the shoulder is often stiff, then healed, then stiff again. It's so painful and sore. Decreased stamina and vitality, accompanied by fatigue, pain here and there, accompanied by depression or irritability. Pain is physically related, but it is also a big mental problem. Therefore, stress management is an important factor. People with high stress, depression, and low job satisfaction become very sensitive to pain. People who are usually depressed or stressed are more likely to suffer from chronic pain. A healthy mind resides in a healthy body. You can overcome chronic pain only if you take good care of your mind and spirit. Chronic pain is often difficult to treat and takes a long time to treat. Therefore, chronic pain should not be neglected for a long time and treatment should be started as soon as possible. If these three symptoms appear together, you should start with the easy ones and treat them together. Chronic inflammation requires anti-inflammatory treatment. Eat fruits and vegetables often, and take omega-3 and lactic acid bacteria. For chronic fatigue, get enough rest and eat fermented foods. Chronic pain must be accompanied by appropriate pain treatment. In order to overcome chronic fatigue, changing your personality is quite helpful. Let's try actions such as losing, conceding, and waiting without winning. It's an action that you can think of seeing a loss, but it's an action for me. In order to alleviate chronic fatigue, we minimize our appointments and do our best in the appointments we have made. It's good to have a break time in your daily routine and take an active break where you can enjoy doing what you want to do. Also, since media such as SNS can make us mentally tired, blocking information media can also be a good way. Myofascial treatment and nerve treatment are also helpful as needed. Severe chronic pain can be treated with brain surgery. When a part of the brain is partially destroyed using high-frequency or focused ultrasound, no pain is felt. Since the brain is an important part, brain surgery is not performed on everyone, and it is aimed at relieving cancer pain or intractable pain. In addition, the main treatment in neurosurgery is to send microcurrents to the cortex associated with pain in the brain. There is also a spinal nerve stimulation technique that sends microcurrents to the surface of the spinal cord. Because microcurrent disrupts pain signals, it can alleviate pain. However, the most important thing in everyday chronic pain is to do regular exercise. Regular exercise is of great help. It is important to make the muscles flexible with Pilates or stretching. Chronic pain is also highly related to chronic inflammation. When chronic inflammation spreads throughout the body, it causes continuous pain in cells, joints, and muscles. Exercise is the most effective way to reduce chronic pain. Increase muscle mass and do sweaty exercises that improve blood and lymph circulation. Build up the intestinal mucosa firmly and pay attention to vitamin D and calcium intake. Women in their 50s must cope effectively with menopause. It can be difficult to deal with because it is difficult to know the cause of chronic pain, but it can be overcome by improving body function. For those who find it difficult to exercise vigorously, my body can be revived just by walking well. Let me tell you about the best walking exercise. Walking with proper posture is the best exercise for my body. Walking is the pinnacle of aerobic exercise. Exercise has so many positive effects on our body. But walking in the right posture will have a good effect. Even a brisk walk of 4 to 5 kilometers will give you all the aerobic benefits. You don't have to walk too fast. If you walk lightly for about 30 minutes a day, you can do the basics of aerobic exercise. Why walking is God's best medicine? You don't have to learn how to walk. It costs no money and can be done anytime, anywhere. A variety of additional activities are also available while walking. But there is another reason why we recommend walking. This is because walking alone can reduce chronic back pain and knee pain. Experimental rats that ran on a treadmill for 1 hour a day, 5 times a week, for 3 weeks showed a significant increase in the number of cells in the lumbar disc and more abundant materials constituting the disc than those who did not exercise. When comparing waist images of people who ran more than 20 kilometers a week for the past 5 years and those who did not exercise at all, the runners had a thicker herniated disc and a higher water content in the disc. There is a study that showed that walking for 40 minutes a day, 3 times a week, for 40 minutes a day, 3 times a week, with knee degenerative arthritis has progressed considerably, and the pain was significantly reduced in 3 months compared to those who did not exercise. So, how should you walk for effective walking? Toes should turn forward or outward 5 to 7 degrees. It's not good if you go around too much, because it's going to be a step. It strains your joints. Most of the reasons for walking with arms crossed are because the hip muscles are weak compared to one's body weight. Therefore, strengthening the buttock muscles is the best way to correct the nasolabial gait. The landing of the foot is from the heel to the sole of the foot to the toes. Keep your back straight and keep only the lumbar vertebrae. The thoracic vertebrae bring the shoulder blades back and open the chest. It's good to walk with your chin slightly raised. Chin pulling has a bad effect on the cervical disc. It is recommended to walk with your legs straight. Thanks for watching.